Good morning. My name is Leigh Ann Bruhn. I'm with Avalere Health. I'm a director with Avalere Health, which is an advisory services firm based in Washington, D.C. And Avalere recently partnered with Janssen, which is part of the Johnson & Johnson healthcare system, on research regarding market access or evolving market access trends around specialty pharmaceuticals. A lot of people ask, why is appropriate use for specialty pharmaceuticals such a priority for the formulary audience, for other stakeholders that are out there? And I think it's just like important to know that specialty pharmaceuticals are growing at a high double-digit rate compared to traditional drugs. So specialty pharmaceuticals, of course, are drugs, higher cost drugs that are treating complex and chronic diseases like cancer, rheumatoid arthritis, multiple sclerosis, etc., as I'm sure everyone's familiar with. The traditional drugs, like more of the primary care, like diabetes, cardiovascular. On the primary care side, or the traditional drug side, you've had a lot of drugs that have gone off patent. There's a lot of generic utilization. It's really brought costs down. So, and the last ESI actually put out a drug trend report at the end of 2012, and they actually reported for the first time that spending on traditional drugs actually decreased 1.5%, versus specialty drugs is growing 18.4% annually. That is a really steep cost curve. So I think all healthcare stakeholders, payers in particular, are looking at specialty drugs and saying, look, we have these innovative treatments that treat these complex chronic diseases, but we just can't sustain, almost 20% a year growth year over year. That's just not sustainable from a budget perspective. So how do we really get our arms around this and make sure that the patients will really benefit from these treatments, are getting it, and not only getting it, but they're getting the support that they need to stay on that drug if they're responding to it. That's what appropriate utilization is about, and making sure that that investment, I always call it an investment, and that specialty drug is actually going to have payoff for the right patients. What came out of the survey is that there's no silver bullet to the management of specialty drugs, number one. I don't think that was surprising to anyone. But I think what was surprising is just the degree of experimentation that is out there. So among these 8 opportunity areas, like for example, within delivery systems, we had them select typically 4 to 6 different activities. Like, are you active in these activities? So for delivery systems, it could be acquisition of provider systems, accountable care organizations with or without risk. Are you participating in this? And across 8 opportunity areas, that was associated with 45 activities, so approximately 5 activities under each one. But we found that when they were asked which, all the respondents to kind of tick off which ones are you participating in and are you active in, collectively, when you look at 90 respondents to the survey, they were participating in 800 activities. So I think that just shows you that there is a tremendous amount of experimentation. We also asked them, what phase of implementation are you in? Like, have you fully implemented this? Are you just starting off? Or are you interim results? And they're in different phases of implementation. A lot of the things they're still waiting for interim results. They're not fully implemented. So I think what will be important for the formulary readers is to really keep an eye on what are you hearing in terms of these different management approaches as different plans or health systems, integrated delivery systems, hopefully report out on what the interim results are. Unfortunately, there isn't that much information that you see in the public domain about what the results of these experiments are. So I would encourage readers, depending on what stakeholder they're with, to really engage in dialogue and talk about what they're doing, talk about what they're finding, because I think it's really the nuances of the approach that really matter. And what the Dimensions report also has is there's 4 case studies that are included in the research that talk about, for example, partial fills, site of care optimization, medical benefit integration, for example, and say, okay, here's a case study of what somebody is doing. And then it pairs it with some good questions about what are the considerations. And we worked with an editorial board for this publication of about 8 or 9 senior leaders from diverse healthcare systems that reflect the respondents reflect the same type of organizations that our respondents are from. And they help to put like a real world spin on it to say, you know what, the results are saying this. This is what I've seen. And these are the considerations that you have to put in place so that if you choose to follow one of these approaches, like the devil's in the details. It's like, how do you do it? Which patient population do you apply it to? Where is it appropriate? Where is it not appropriate? Collaboration. Who do you need to get on board? You asked me what the key takeaways are. I'd say experimentation, so many different areas of activities. The other second key takeaway area was in terms of succeeding in these opportunity areas, the number one critical success factor that was cited by our respondents was provider acceptance. Number two was collaboration with external stakeholders. So it wasn't necessarily, do I have enough capital? Do I have enough money? Important, definitely. But what really shined through was just how critical it is to get providers on board. So I think a lot of people would say, well, how do I do that? And I would say that is a great question and something that is really a great question to tee up for future research and for others to look at as well. Is for these approaches to be successful, you need to engage providers in the process of developing them. Clinical pathways is a great example. The organizations who have developed clinical pathways and have seen some initial successful results in terms of getting providers to adhere to them, and maybe I think it's a little too early to see the patient outcomes piece of it. That's absolutely important as well. But they've said, you know, we were actually successful in at least implementing this and getting adherence to it because we included the providers in developing them. It wasn't something that was just like developed in a vacuum and then given out, you know, say, go follow this, go do it. Providers are in a world where they're taking on increased risk. They're being asked, they're being charged with, you know, not only do you apply an intervention or prescribe a drug, but now they're more and more being asked to, especially with the advent of, you know, or the increased proliferation of accountable care organizations, they're being like on the hook for what the outcomes of that patient are once they, you know, leave their office or leave their operating room. So I think that if they're going to be on the hook and accountable for the outcomes of the care and the cost effectiveness of the care, they also want to be part of the development of that and understand, you know, how it works and what their role is and how they can be a partner with, you know, the health plans, for example, who are determining coverage for drugs and medical interventions, et cetera. So those, I would say, are the two key takeaways: the high degree of experimentation for these management approaches, and really like the key importance of provider collaboration.